Are you someone who is suffering from recurrent episodes of severe giddiness, vertigo, where it seems that the entire world around you is spinning? Along with that, you are having nausea, you are having vomiting, and interestingly, you can see that there is some problem with the inner ear. Whenever you are having this giddiness, you seem to hear less, or there is an abnormal sound in the ear, or you feel that there is a blockage in the ears. After some time, when with medicines or with your a bit of rest, whenever this giddiness or vertigo subsides, you feel that you're feeling a bit relaxed and the ear related symptoms have also subsided a lot. If you are someone who is suffering from this disease or you're suffering from these symptoms, then kindly look into this and watch this video fully. Now, what I'm talking about is there's a disease called endolymphatic hydrops or a hydropic ear disease, or more commonly, it's known as a Meniere's disease, in which the inner ear, which usually have two components, one is the hearing organ and another is the balance organ. Now, these two hearing and the balance organs are embedded in a space which is surrounded by fluids called endolymph, and this hearing and the balance organ swims in the endolymphs. Now, what happens due to various causes? Could be an allergy, it could be due to autoimmune cause, it could be a genetic, it could be a electrolyte imbalance, or it could be sometimes due to overproduction of the fluids, any hormonal changes. There are a lot of factors which leads to over accumulation of this fluid in the inner ear called the endolymph, and this process is basically known as endolymphatic hydrops. It means excessive accumulation of endolymph. Now, what is the ultimate effect of this? Now, as the inner ear pressure increases due to increase in endolymph, it causes pressure in both the organs which are embedded in it, like the hearing and the balance organs. Now, when the pressure is too much in the balance organs, it leads to giddiness, vomiting, nausea, and similarly, along with it, when the pressure is also simultaneously increased in the hearing organ, it leads to increase in sound. It's called tinnitus, or it can have a ear fullness, or sometimes you'll be hearing bad, hearing level decreases. So all these things are actual symptoms of a disease called the Meniere's disease. Now, what are the investigations? The investigations is we can have a clinical detailed examination with otoscopic examination. We can need to do a pure tone audiogram, which is usually done in all the clinics. There are specific tests, diagnostic tests called electrocochleography, where we see the electronic potentials developing from the inner ear, basically the hearing organ, that is called the cochlea, and we can check the hearing levels and the ear pressure, whether it's related, whether it's more or not. Apart from it, there are other tests called the calorics and the VHIT, video head impulse test, which we can see a dissociation in it in cases of Meniere's disease. So in this way, if we can clinically and with the investigations correctly diagnose the Meniere's disease, then there are absolute treatments for this disease also. And the disease treatment basically varies depending on the cause. If the cause is related to comorbid migraine, then we get migraine prophylactic medicines. The key to this are the diuretics, very important medicines which also helps to release the inner ear pressure. Then there are other lifestyle modifications like high potassium diet, which has shown to give very good results. Now, more than 95 to 98% patients actually has resolved fully with this kind of Meniere's disease with medications only. But in 1 to 2 patients, 1 to 2% of the patients, we may need to go for surgical interventions like an endolymphatic sac dissection or the vestibular neurectomy. Or in some cases, we may also need to give an intratympanic injection of some of the drugs. Now, what is the prognosis of this disease? Now, I tell you, if the proper diagnosis and proper treatment and the investigations are properly done, then there is a high success rate and majority of these patients suffering from Meniere's disease are actually fully cured of this disease. Thank you very much.